Hi guys, welcome back to the channel. I'm here with Nick Hilton, the PC representative for Yarmouth, Nova Scotia in the 2024 provincial election. So Nick, could you tell us a little bit more about yourself?
Well, thanks for having me.
No, thanks for taking the time to speak with us and the viewers. I think we'll all appreciate it and get to know you a little bit better and be more informed on who we're going to vote for on the 26th.
Thanks. I've been a resident of Yarmouth for 41 years. Grew up in Chicago. My parents, my mother works at the hospital. She's an ultrasound technician, and my father, a bricklayer, owned his own business for 40 years. I grew up working with him and kind of supporting the community in any way that I can. Lifelong 4-H'er. Always believed that 4-H makes the best types of humans possible, and love sports. I've been president of the Golf and Curling Club the last few years. Traveled Nova Scotia curling. Made friends across Canada, really. Recently, we've hosted 2 Canadian National Curling Championships, and bringing Canada to Yarmouth and showing off what Yarmouth is all about. And I just really love supporting community in any way that I can. And in 2020, I ran for municipal council and was elected, representing Chibougue and Sand Beach, Rockville, part of the Hard Scratch Road in Brooklyn, in Greenville, and couldn't be more proud to have to be representing that area. We just had a municipal election, and it was a tough decision on what I was going to do, but no one had put their name in prior to the election. It was tough because I'd already committed to run for the PC party.
Absolutely.
And it was a tough decision on what I was going to do, but no one ran, so I put my name in because I believe to be on municipal council, you need a strong voice, and I believe I've been that person. We've had some ups and downs over the last 4 years, and it's important that you have strong representation. And now I'm here doing this, and I'm excited to represent the PC party in Tim Houston. I believe that this is the party that's making the most difference in things like healthcare, and just overall changing the morale of what the last 4 years has been like. We as a community need to grow and be a little bit more positive in the way we look at things, and I feel like we are making a difference, and look forward to representing Yarmouth at the government table.
Well, that's great to hear. That really is. I like some of the points that you landed on. You talked about being involved with sports and recreation and things like that. And in our previous conversation, you told me about the Mariner Center expansion. And since that conversation that we had, the planning and approval has gone further with that. So I'm wondering what you think about that as the planning and the promotion of that go forward, as well as other programs that might bring sports and recreation to the community and the community as a whole.
Yeah, so we awarded the tender to a company out of Halifax, because there's no company around here, unfortunately, that builds buildings of that size. But we awarded it, and it's breaking ground now, and we're going to see that new building. And when we started the process of building a new pool, it was pre-COVID, and that was the biggest problem that we had, was that our pool at the YMCA had closed. It was a huge loss to Yarmouth County, and that was my goal. One of our goals going into my first term on council was to get the pool back open. So it's the first time that all 3 municipalities have worked well together in over almost 25 years to build a building, and I'm super proud of that. One thing in government, if you don't have relationships, you don't really have anything. It's all about building relationships, and working with the town in Argyle has been rewarding, and we're seeing that with the construction. We know that it's an expensive build. It's over $40 million. And some people say, well, why aren't we spending that in other areas? But the fact is that money was, especially from the federal government and from the provincial government, was allocated for recreation type infrastructure, and we're partnering on that so that we don't lose that $20 million coming from other avenues. So excited to build a building. It's going to we didn't have to make any dramatic cuts, so we're getting the building that we deserve, and the people of Yarmouth hopefully will be supportive of that, and see what a crown jewel will be out there next to Mariner Center. We're going to have a campus campus-like recreation facility, hopefully for all residents of Yarmouth. And we talked about accessibility to that.
Absolutely,
And,
I was going to ask you about that in our previous conversation, how about maybe disserviced individuals in the community might not be able to access that service.
Yeah.
So have you had any time to think about that any further, or come up with any plans going forward if you were to be elected that we can allow individuals in the community to access those services even if they can't afford it?
So I know that Mariner Center has just increased from 200 to 250 pay-as-you-go pay-as-you-can memberships.
Okay.
So the biggest thing I can do is if you want to be there and you're worried about the cost of membership, is ask you to talk with the management there. They will figure out a way to make it inclusive for you, and if not, then let's have a further conversation.
Yeah.
But when I say pay as you can, that's exactly what it sounds like. They'll talk about what they need from you and what you can give, and settle on something that works for you. We want the community to be active and healthy.
Absolutely.
You know, I find for me, anytime I'm involved in recreation and making those community relationships, I feel better about myself, and that shows not just through recreation, but through all aspects of my life. So
absolutely,
encourage everyone to do
absolutely, and I appreciate that. I think the knowledge to say, you know, that this program is available to some of my viewers, and we can disseminate this to some other people, that we're going to get more people into these programs and these pay-as-you-can programs, so that they can get there, because as we know, healthcare in Nova Scotia is obviously strained. That's because of doctors and facilities and things like that. Like we have Shelburne Regional Hospital that closed down because lack of doctors, as well as Digby, and they forward patients to Yarmouth Hospital. So if we focus on the general needs of the public and their health and their recreation, I think that will also take a strain away from the healthcare system, because we're promoting healthy lifestyles in our communities among everybody, instead of just a select few that can afford it. So I think that's a great thing to see. Now, also, I'd like to speak to you in regards to healthcare. You had said previously to the video that there is, last year, was it 20,000 doctors over the last few years? Maybe you could explain that a little bit better.
Yes.
What the Tim Houston administration has done for doctors in the last 3 years.
So I'll go a little bit more. When I introduced myself, I'm not sure if I mentioned that I've been a nurse for 21 years. And when I started in nursing, like, we had a lot of fun. We had a lot of fun working nights. We had a lot of fun working as a team of nurses, and some of the people I started with are still some of my best friends. And I know over the years that the morale has changed, and some of that is because of the lack of staff available to fill positions, so you end up getting burnt out. And over the last 3 years, as a healthcare professional, I've felt more appreciated through retention bonuses and things like that, and getting paid what I would be paid anywhere else as a nurse. And part of that, it makes you want to stay at home, and it makes you want to go to work, and I think that's being felt across the board, and that along with other changes are making people in healthcare see a change. And I know it's a slow change, but it is a change. So we have 250 more doctors in Nova Scotia since the moment net 250 more. We've seen that's on top of a significant number of retirements over the past few years. 35 of those are here in Southwest Nova Scotia. A lot of specialists, it's still a struggle to find family doctors, but we're working on that as well. The government is working on that as well. When the PC government took over, there were 75,000 on the no doctors list. And Mr. Houston, he was here yesterday in Yarmouth, actually, and we can talk about more about that after.
Sure.
But he said that it was going to get worse before it gets better, because every time a government comes in, there's a delay in the policies that they create. Right? We're trying to fix healthcare for 1 million people. And he said it would get worse before it got better, and that list grew to 167,000 Nova Scotians. And in that time, they provided doctors to an additional 100,000 Nova Scotians. So you're talking 25% of the province that at some point didn't have a doctor.
Yeah.
So now We're seeing through a number of the programs that the government has put in place, we're seeing that list start to decline now. In October, they signed 20,000 Nova Scotians to a new doctor, and here in in September, 20,000 new. In October, I think the number is going to be just below that, but you're going to see that list come down, and I think what Mr. Houston wants everyone to know is that they want every Nova Scotian to have a doctor.
Yeah.
We grew up with the idea of a family doctor, and if you didn't have one, you were at a loss. And I think what's also important to know is that if you need service right now, you can see a doctor through either through a primary health clinic or the new urgent care clinic at the Yarmouth Hospital. You can see a pharmacist who can now prescribe more, nurse practitioners that now can prescribe more. So our goal is for everyone to have a family doctor, but our goal is really for everyone to have access to care, and that's slowly coming. And I know it's not perfect. I've heard at the doors issues with some of the things that we're doing, but at the end of the day, that's because we were so far behind when this government took over that we really just need to continue to work and be positive about it. And I feel like every Nova Scotian will get that call in the next few years to get a family doctor. Like for me, when I think about it, a normal caseload for a family doctor, it used to be 5,000. You never see that anymore. So let's say a normal caseload is 2,500 clients. Well, if we only got 130 or 40,000 people now on the list, that's less than 100 doctors to replace there. And the two things I will say about some of the work that we're doing is they created a new medical school at Cape Breton University. That's going to start, and when that's up and going, that's 30 new doctors every year that have to spend 5 years in Nova Scotia.
At least 5.
Teaching, and hopefully, and it's geared towards Nova Scotia residents. So hopefully, when I say 5 years, hopefully it's a lifelong.
It's a longer retention.
Right. We're paying doctors more appropriately. We've across the board, like they would be anywhere else in Canada. We're starting a doctor's pension plan so that they feel like they can plan for their future. Maybe that will create retention. Also in January, you're going to see an international assessment clinic start in Halifax. The old assessment, so if someone came here from away, even if it's a Canadian that worked abroad that wanted to come home, to get their Nova Scotia license, it would take 18 months to do that. And that's going to be down to 12 weeks. So we're gonna graduate.
That's a huge decrease then in time.
Yeah, we're going to graduate 45 doctors from that assessment clinic each year, with again the idea that they stay in Nova Scotia. So that's 75 new doctors each year. So that when I say we need less than 100 family physicians, in the next couple of years, we're going to have those.
That's great. That's great news to hear. And as I hope that in the future we do see these doctors and these programs work as the way that they should, right? And as a healthcare professional, I want to pose something. It was a comment that I posed to Zach during my interview with him, and I'd like to ask your comments on it. Recently I went to the hospital. I attended outpatients, and I was there for about 7 or 8 hours. And once I was finally called, after being triaged and waiting my time, I was brought into a room where I was seen by a doctor through the Maple app. Now, is there any way, because I understand that there's a long wait time at primary care facilities in Nova Scotia, maybe not so much in Halifax, but down this way we do have long wait times from time to time. Is there any way that the provincial government could potentially lobby Maple or through MSI cover the $50 fee that would be for someone who accesses the same service at home rather than accessing it at the hospital where it's paid for through MSI, which would lower the amount of individuals for like chronic ailments that they could maybe necessarily deal with their family doctor or a pharmacist or something like that they don't need specifically to go into the hospital, but they can stay comfortably at home. The wait time would be lower for everybody because they would be at home and not creating higher numbers through the triage list at the actual hospital. And the cost would still be there. It would still be the same amount of cost that MSI is paying for these individuals to see a doctor, but instead of having them be there, they can stay in the comforts of their home to access these services that they would have inevitably been accessing if they were at the primary care facility.
Yeah, so I think I think you kind of nailed it in general in the way that we want people to access care through your Nova Scotia Health app. That's slowly growing, and some of the recommendations in there, it tells you to go look for Maple. I don't know, and I'll be honest, I don't know the whole the cost and how it's paid and who.
So I've used it as an individual,
yeah.
And I know if I use it as an individual with a family doctor in Nova Scotia, which I do have a family doctor,
Mm-hmm.
my doctor is Michelle Kane. Sometimes the wait periods to get into her are quite long,
Mm-hmm.
and also when you're dealing with maybe emergencies or ailments that you want to go to outpatients for, it doesn't necessarily mean like I can't call my doctor that day and get in
Absolutely,
that day, right? So the cost for me with a family doctor as a Nova Scotian with no health care is $50 to speak with a doctor. I don't know if, obviously, I'm not sure if the provincial government is getting some sort of a discounted deal from Maple on that. I know they are a private organization, but I think it's something maybe the Houston administration and you as well could bring up to Mr. Houston and say, well, hey, if we're already paying for this for individuals that are in the hospital, why can't we pay for it for Nova Scotians to access healthcare at home and make their stays and the wait times more comfortable for them?
Absolutely, I think that's a great idea, and I know that that's kind of the whole goal is the system is direct people where they need to be at the right time. So if I need to see a doctor, I see a doctor. If it's something a nurse practitioner can do, and if it's something that you can do on Maple, that's fine. And I know, if you're lucky enough to have health insurance, you get 2 Maple contacts free a year or something like that. But what does that mean for people that don't have the income to support that or the job to support that? So I think it's a good recommendation, and one thing about Tim is that he's more than willing to listen to good recommendations, and you'll see that in our platform. Those are ideas that have come from doctors within the system. The International Assessment Clinic that we talked about, that's a recommendation from physicians that said this is what's holding up the progress in the system. So I don't want to comment too much on the Maple app because I don't know enough details.
Absolutely. I think it was more of a comment that I wanted to make to you as an individual who may be able to speak with somebody about that and maybe get the ball rolling if it's a possibility, right?
I have lots of friends that have used it. I mean, and had good results from it. And I know it's a different way of receiving healthcare. Some people are open to it, some people aren't, but it's an option. This government has created more than 1 million more primary care appointments over the last couple of years. That's there's only 1 million Nova Scotians, so that's one for every Nova Scotian if they wanted to see a doctor in the last year, and that's significant. So we're working in the right direction, and like you said, it needs to be accessible, but it also needs to be affordable. And we're lucky enough to live in Canada where healthcare doesn't cost us a whole lot.
Exactly.
And we heard this week that that the Houston government and possibly the Liberals too are going to remove the cost of parking from all healthcare facilities.
Yeah, I saw that. Yeah.
And that's significant for a lot of people if you're visiting a loved one, or if you're there maybe on what could be the worst day of your life, and
you're stuck behind the gate because you don't have $2.
3 or 4 or 12
or
25.
I've heard the
Halifax,
costs
right?
have skyrocketed over the years. I remember the last time I paid for parking at Yarmouth Hospital, I think I paid $2 or something.
I think it's 3 now.
And like you said, in other parts of the province, that you could be $20 bill just to park, right? So I think that's a good boundary to have removed. I understand that parking in the past, the funds for that were to go to upkeep the hospital and things like that. It went to it was more or less for non-profit.
So
from what I understood,
so
anyways.
$8 million is what the cost of is what parking had brought in provincially, $8 million, and some of that did go to nonprofits, and the Houston government wants to be clear that those nonprofits will be made whole. Like if there's a loss, they'll be made whole. For my household alone, it was $600 a year. So my wife and I am both a nurse, and
because you work at the hospital.
$25 a month, so $600 a year. So that's a couple grocery bills that I will now have back in my household, and any healthcare worker will have back in their household. So it is significant. If you only went once or twice a year, it wasn't. Some people will say, well, it's not that big a deal, but For people that have to go there regularly for blood work or treatment, cancer treatment, all those things, just one less barrier to care. So I'm excited about that one. It's received well at the doors. For some reason, when I started, we didn't pay anything, and even just that affected people's morale. You know, it felt like we were being caged in at the hospital.
Yeah, I can only imagine.
Yeah, so that's an exciting one too.
So I had a few questions that were asked by a couple of viewers that they wanted me to ask you.
Sure.
One of my viewers actually was my spouse, and she wanted me, and I said I'll definitely ask you. I have to, or she'll yell at me when I get home. So she wanted to talk about obviously the housing, and as well as childcare providers in Nova Scotia, because as a childcare provider herself, she kind of lives in that realm of the lack of childcare providers in this area. We have two major childcare providers that are the Boys and Girls Club of Canada as well as Little Gems, and on top of that, there's a few independent. But what would the Tim Houston government going forward, especially if you're elected in this area, do to maybe help childcare providers set up new locations and new daycares for children to be taken in and cared for during the day while their parents go to work and pay taxes and be productive members of society? Because as it is right now, my children have been on a wait list for the Boys and Girls Club for 2 years now. And like I said, Little Gems is the only other proponent to childcare realistically that's subsidized or funded through the province in this town, and the wait list for Little Gems is basically the same.
Okay. So I do have a stepdaughter. She's older now. She's 28. She's at Santa Fe, and been a long time since we talked about childcare.
Yeah.
But I'm of that age where all my friends have young children, and they talk about the cost of childcare and the cost of raising a kid right now. The cost of having two adults and 2 kids in a household is astronomical. So, around childcare specifically, I mean, that's the mandate around our mandate for the next the 4 years is to continue to work on healthcare, but it's also to continue to work on the cost of living, which you see with the things like the 1% HST cut, tax bracket indexing. So Nova Scotians are going to see $3,000 more of their money in their pocket without being taxed provincially. And we're going to continue to try to keep more money in your pocket so that it's more affordable for you to live and enjoy life. And childcare, I know previous governments have done a lot of work with that, and we've just added the free lunch programs at schools.
And not to interrupt, but obviously the government in the past has subsidized childcare. They've done a lot, right?
Yeah.
They have done a lot for childcare, and I don't want to say that they haven't done anything. They absolutely have done a lot for childcare, especially with the wages for childcare providers and the amount that families need to pay. I guess her concern is the availability of brick and mortar locations, right? And the accessibility for individuals who may want to start that type of thing to be able to. Because there's a lot of red tape when it comes to childcare, and obviously there should be. We're talking about children and the safety of children, and these are the future of our country, right? So we should take care of these individuals. But when it comes to certified individuals, there's still a lot of red tape involved in that, in them starting a business and starting childcare and doing the paperwork and applications for accessing subsidies and things like that, which would make it easier for families to want to send their children to that specific location. So I don't know if there's anything potentially that the Houston government can do about that, making it easier for individuals who are already childcare providers to start independent childcare provider businesses and brick and mortar establishments, because then it takes away from the wait lists, right? We're adding more options for families in our communities to say, okay, well, this daycare can take 10 kids, and there's another one the street over, and it reduces the amount of time that a family may have to walk even in this town to drop their kids off so that they can make it to work on time, right? Because we're making them more available in the community, because as it stands right now, we have the Boys and Girls Club at the NSCC Burge campus, and we have the South End location, which are the two spots that are centrally in Yarmouth. and then we have Little Gems, which is outside of town. So if you live, we'll say Parade Street, you're walking either way 15 to 20 minutes with your small child to drop them off to daycare for you to have to walk to go to work. And if you're at Little Gems, you're taking a cab, which is $10 each way to get your child so you're able to work. So I think having more availability in the community of smaller centers, I think would help reduce the wait times and also provide good childcare for children, and something that instead of it just being a grandmother or something that wants to watch kids and she posts it on Facebook, it's more official, it's more stringent, there's more guidelines behind it as opposed to a babysitter for these children.
Yeah, so I think that's going to be a takeaway from this conversation for me, to learn more about that myself. And my goal as an MLA is, like I said earlier, it's all about relationships. And I'm going to have routine community days in my office where we can sit down, take those notes, and meet again, and meet over and over again until we have all the answers, and see if we can provide some information to the provincial government and Mr. Houston to say, is there something we can do about this? And maybe there is more that I don't know already.
And maybe there is.
Yeah.
Right? I think it's just we need to have that conversation.
Yeah.
And obviously I don't expect you to know all the answers, right? Like we're all human. You're one person that is a part of a larger group of individuals that govern our province.
Mm-hmm.
So I don't expect you to have all the answers, but I think it's a good thing that you listen, and even if you don't know the answer, you're very transparent about that. You say, I'm not sure about that, but I'm going to take it away and I'm going to learn about this. So I think the viewers are going to be really happy about that. That even because in times in my speakings with other individuals, there's been a lot of times where if they don't know the answer to a specific question, there's been a lot of finger pointing, and I think the time for finger pointing is gone. I think we need. There's been a motto that I like to say is, instead of acceptable solutions, we need excellent solutions, right? It can't be acceptable. We've dealt with acceptable in this province for enough. We've dealt with just getting by on the bare minimum for far too long, and I think we need to come up with some excellent progress. And I think that if we have another term of Tim Houston and you as our MLA, I think that'll give you guys the time, because we've only had 3 years, right? And in government, what can you really do in 3 years? There isn't a lot, right? It takes time. These processes aren't overnight. And I think if we have another term of a PC government in Nova Scotia, and then next year when we go to a federal election, and instead of having what would be a minority government that we have right now, we have a majority government again, I think these plans and these programs that the PC government of Nova Scotia as well as the federal government will come very quickly. And I think that's what we all need, and that's what we all hope for in the future. And I know as a constituent myself that I hope for a better tomorrow, and I think that a lot of Nova Scotians are hoping for the same thing.
Yeah, and for me, that change in morale, like, it's been a hard 4 years, like, across the board, and we lost a little bit of our ability to look at things in a positive way. Things are never going to be perfect, but sometimes we need to smile and do the best that we can.
Absolutely.
And as government, we want to make that as easy as possible for people. But I also need you to support me, and I'll support you. And,
Absolutely.
And together we'll get to a place where we are better off. So I see that with this government here, with the way they've supported healthcare, and the way that they're now going to try to support Nova Scotians with the cost of living and keeping more money in your pockets. We've I think focused a little bit on seniors, and today's conversation around how do I continue to support you as a parent, young parents, that hits home as well, and just remembering that we have such a vast range of people here in Nova Scotia, and we're really in it together. So
yeah, absolutely, and we are a very diverse culture in Nova Scotia. We have French-speaking individuals, English-speaking individuals. In the last little while, we've had a large influx of immigration in Nova Scotia. We are very multicultural, and I think Nova Scotians have always had the impression, and people always thought of us as kind and willing to listen and willing to speak and come to terms and come to agreements for ourselves, for the better of our province. Now, in regards to housing, there's been obviously some serious things going on with housing, and recently the Trudeau government announced that they're going to slow down or mitigate the amount of immigration in the country for the next 2 years to 3 years. Now, do you, as an individual and a member of the PC party, do you think that is actually going to make any difference when it comes to the numbers of Canadians that are already here and the immigration that has already come that we weren't necessarily ready for, especially in Nova Scotia?
So, around housing or just in general?
In general.
In general, I think Nova Scotia, we sometimes the way we were bringing people into the province was mixed up with some of the federal policies. I think Houston's and our government's work was focused on bringing quality healthcare professionals and professionals of any sort into Nova Scotia so that we could rebuild kind of the professional entities so that we could support Nova Scotians around healthcare and things like that. I don't think there's the whole, we were going to double the population of Nova Scotia. I think all of Canada is starting to realize that we can't do anything until we focus on what our infrastructure can support.
Absolutely.
Right? Yarmouth specifically, we just had gentlemen in here talking about the quality of housing in Yarmouth, and we know that the quality of housing in Yarmouth is poor, and we need to continue to work and invest in infrastructure and safe places and warm places for people to be, but before we get to the point where we should be trying to double the population. So I think right now in Nova Scotia we're okay. We just need to continue to support the residents that are here, and continue to make investments where we can. I know that we're going to see a number of houses. I know housing right now in Nova Scotia is up 25% over the last couple of years. So we are making investments in housing. We're making money available for businesses to want to build housing. The goal is really just to have a safe and warm place for everyone to be.
Right. Now, talking about infrastructure, as a carpenter myself, that's kind of my mainstay, right?
Mm-hmm.
I like to talk about that kind of thing. In the past, I've looked at sort of programs that the federal government as well as the provincial government has put on tradespeople and incentives for getting individuals interested in trades. Now, this might be a topic that some people don't agree with, that I have a personal opinion on. Now, I believe that in the past we focused on getting individuals with disabilities as well as women interested in trades by subsidizing their tuitions as well as their student loans. To me, that seems like a foolhardy plan to me, because I compare it to trying to get men to buy more lipstick, because men don't want to wear lipstick, or not all men want to wear lipstick, and not most women and most individuals in trades or with disabilities don't want to be in trades. So we're incentivizing these individuals to want to be in trades, right? Instead of incentivizing the individuals who do want to be in trades to go and get a good education and focus and take their time to be long time builders in our communities. Because if we have individuals who need to be provoked to go take a course, well, what's going to be their retainability in that field after they leave? Because it was something that they already didn't want to get into in the first place, but they were only incentivized into the program. Now they have a degree and they've worked for a year or two and they decide that this isn't really what they wanted, and they knew that it wasn't what they wanted at the beginning. So how can we incentivize all Nova Scotians across the board to get into trades instead of just focusing on underrepresented groups of people who realistically don't want to be in trades?
So I think that's kind of I don't feel like the PC government looks at things quite that way. Like I feel like that's governments in the past. I feel like this government, has tried to incentivize anyone and everyone to come to the table to work.
Yeah.
The most program where people that do trades training now, the first $50,000 that you earn in a year, we don't tax. We want people to take up the trades. When I was a kid, it was like go to university, get a degree,
Yeah,
something,
exactly.
right? And I don't want to say trades were looked down on, but it was go to university, get a degree. That's how you're going to survive. That focus, that one-directional focus, then we realized that we didn't have enough tradespeople to do anything. So I feel like Houston, through his programs and through where we're supporting, even like through healthcare, when it comes to nursing, when it comes to those types of things, here's a program. It's for everyone. Everyone needs can take advantage of it. And, they're funding a licensed practical nurse course in Halifax across the board. Their tuition's going to be paid across the board this year.
That's
right?
what I like to see. Right? Is total acceptance. Right? Because as a white male in 2024, there isn't much offered to you. Right?
Yeah, and I don't get me wrong. We want to make sure that everyone, disabilities, diversity, all that,
absolutely.
everyone
I
that's
don't
inclusive.
want to exclude those people either, right?
Yeah, we just want to make sure that you as an individual are feeling that you're a part of Nova Scotia and that you're a Nova Scotian that the government's supporting as well.
Yeah.
And there's always going to be some programs that me and you don't qualify for.
Of course.
But there should be some that you do, and I feel like Mr. Houston's government is making everything inclusive across the board. Like I said, the trades with the most program, healthcare, a lot of funding for CCAs, LPNs. We're just trying to build back capacity in those fields so that we can support the aging population. So.
Yeah.
And we're talking about building 25 or 35% more housing each year.
Yeah.
You as a carpenter needs that support as well. So
Absolutely.
I feel like this government, and that's what I like about this government, is that they are, the programs that they're putting in place are to support Nova Scotians, not individuals. So.
And I think that's what we need, right? Because as Nova Scotians, we are Nova Scotians, right? We're proud to be Nova Scotians. We've always been proud to be Nova Scotians. I know I am anyways. I speak for myself. I'm a very proud Nova Scotian. And when I look at certain policies that I've seen in the past, it makes me feel like as a Nova Scotian, I'm not respected. I'm not taken care of. I'm not looked at. I'm not taken seriously. And to hear these things that, the PC government and Houston administration going forward really wants to bring inclusiveness to all Nova Scotians really makes me happy. It makes me happy about myself and my individual situation, and I think it'll make some of the viewers feel a little bit better too.
Yeah, we don't hear that Blue Nose or proud Nova Scotian. We don't say it enough anymore. People are tired and feel like they've been beat down, and that's one of my goals as the MLA here, is to kind of bring a little bit of community spirit back. And we, like you said, we are a more diverse community than ever, but just so that we all feel included.
Exactly. And diversity doesn't mean to say that we have to be separate, right? We can be diverse and be a community as one, right? And I think that as Nova Scotians, and as individuals of Yarmouth, and Acadian individuals, I'm Acadian, and I think that we've always accepted people, and we've always wanted to make good relations with people, and that's kind of our history, and that's our heritage of Nova Scotians and Acadians. And I think that a Houston government that promotes that is really promoting the values of Nova Scotians, and I think that's a great thing to do. I think that's really good. Lastly, there was one thing that was asked by Ms. Smith, one of my viewers, and as a healthcare provider, I'm curious to know your opinions on it, or maybe your lack their opinions, or maybe you have no idea what this is about. Bill C-293 I don't know if you have any comment on Bill C-293. That would have been pandemic prevention and in the future looking at ways to better deal with pandemics that may come into the province in the future and potential policies that we have now going forward. Is there anything that maybe you can think of that we could have done better in the past to assist Nova Scotians during the pandemic? Or is there anything that you may have think that we failed in doing that we could have done better when we assisted individuals in the pandemic?
Yeah, so I don't know the ins and outs of the bill, but I'll just say, you know, as a healthcare professional, and just as a Nova Scotian, as a human, the last 4 years have been, they weren't like my first 37 years.
No, absolutely not.
Right, so do I think we got everything right? No, I don't. I know as a healthcare professional, this is personally not party.
Yeah, absolutely.
That, you know, I took my H1N1, but my COVID vaccine, so I could keep my job, and but I also took it to protect my parents. I thought, you know, this is what I'm doing. This was the right thing at the time. You know, hindsight's 2020. I don't know what the right answer to that was. Do I think we need to do more research, more planning? Because there's probably another one coming. You know, the population of the planet continues to grow. We're at more risk to experience.
In the history of human society, I'm sure we're going to see another pandemic before the extinction of humans.
Yeah.
I'm 100% positive of it. So.
Yeah, so I don't think we got everything right. I'm not sure that we got everything wrong either. You know, mandating people to do things that they were uncomfortable with. That's a tough situation for any government. I do think if we did nothing, that our hospitals would have been overrun. They were as it was, and lots of nurses seen lots of things that you know they're going to live with for a long time, and part of the reason that the healthcare system started to fail and people became burnt out and tired and looking for other jobs, you know, taking jobs where they don't make half as much money as they did in healthcare, but their peace of mind was that much better. So you know, a lot the bill was federal policy, I'm assuming.
Yes.
Yeah.
It was, yeah.
And I think as you know, Yarmouth didn't even see a COVID case for the first 14 months, right?
Like we were one of the safest places in the country for the longest time, and I think almost in the world for the longest time there, that Yarmouth, and I think that led to a lot of people moving here, and which also exacerbated the housing problem, but I think that's kind of a conversation for another day.
Yeah. And you know, when it did come, people were extremely anxious about the whole thing, just the perception, the stigma that went with it. Like, you know, who knows what the next pandemic will be, but I hope we all know that in the end we will get through it together. We can make better decisions, and you know, you do have personal choice, and we, you know, there was two groups: the people that took it and the people that didn't, and that created a lot of the stress that we've already talked about, and hopefully we'll just do better when and if we go through something like that again. But at the end of the day, you know, I did what I had to do to protect my family.
Of course.
But that was the way I seen it. I don't have any views towards anyone else and what they decided to do. So we'll get through it together and we'll continue on.
Perfect. Awesome.
Okay.
So those are pretty much all the questions that I have for you today. I don't know if there's anything that you'd like to add at the end of this, anything that we've talked about, any comments that you'd like to mention to me?
Just kind of around the election and the importance of it. I do think that the Yarmouth riding is going to be one of the toughest for the PCs to win. We have the Liberal leader here, and it's been a long time since anyone's unseated a leader of a party. But I do believe that this government, the Houston government, is going to have a majority government again, and Yarmouth needs to be on the side of government for once at the decision-making table and not in opposition. So look forward to supporting our residents at that table, and you're not going to get a traditional voter's card because of the pending federal mail strike, and people are going to struggle to get out and vote. And if you're someone that wants to see change, I feel like you're going to struggle the most. So you can vote any day, Monday to Saturday, except for Remembrance Day, downtown across from Jake's at the old Metropolitan Building.
Okay.
Or on election day at your designated poll. But the problem is, without that card, I'm not sure where the designated polls are. So
Okay. Yep.
just get out and vote,
Yep.
and your vote really does matter here. Like, I can't stress that enough. People always wonder, you know, we talk about civic duty and those things, and the responsibility, like, oh, my vote doesn't matter. That vote matters this time. And for fishermen, dumping day is the day before the election. It's never been more important that you get out and vote early. I think, you know, there's a lot of conversations around the illegal fishery,
Yeah.
and I know that we want the federal government to finally put something on paper that sets some rules, makes rules equal for everyone in some ways, so that we can continue to depend on the fishery here in Yarmouth. It's really the backbone. Fishery and healthcare. What else?
What else do we got?
What else do we got?
We got a major hospital and we got major wharfs. So
Yeah, and that brings up a whole nother issue of what Nick's going to do in 4 years, and how we're going to grow industry and economy here. And one of my projects is going to be to try to make something happen at our local airport.
which would be nice to see.
Yeah, we have a new business there that's doing some work with some drones. What if we created a little bit of a hub of aerospace industries at the Yarmouth Airport?
Why
So,
not?
right. So looking forward to doing that and bringing that to the table in Halifax, as well as, like I said, creating more relationships, bringing more people here to see what beautiful assets and what a beautiful community that we have here in Yarmouth.
And I'll say, as a lifelong resident as well as you are, Nova Scotia and Yarmouth in particular is a hidden gem that people need to come and see, and they're missing out. They really are. And just to add on the election, how we can vote, if anybody has any questions, I'm sure they can go down to the elections office and speak with David Solos or any of the other staff there,
Yeah.
and those individuals will gladly help them figure out any ways that can assist them, or if they need any assistance in actual voting, whether it comes to hearing impaired or visually impaired individuals, or I'm sure that David Solos would be the person to speak with about that, and how to any further information on how to vote.
Yeah, the elections returning officer name is Gail Van Breen.
Oh, David! I thought David was doing it. I apologize to the
No,
viewers.
David was for the town election.
Oh, okay,
Yeah.
so it's Gail then.
Yeah, Gail, and you can vote, like I said, there across the road from Jake's at the old Metropolitan Building. There is one on William Street at the Holy Trinity Church for a couple weeks.
Okay.
And then on election day, wherever your poll is. And if you can't get out to vote, because unlike in the municipal election, you could vote online.
Yeah.
There is no online voting, but you can call. You can have someone bring a ballot to your home. You can vote at your home
Okay.
over the next 2 weeks, and if you have mobility issues, and they'll make sure your ballot gets in the box.
So there's a lot of accessibility options then.
Yeah, not as many as maybe in the municipal election, but it has to do with the timing of the election.
Exactly.
We'll make it happen, but your vote has never counted more than it does right now, especially for me. So if you get out and support, it's greatly appreciated, and I'll do my best to support you.
Well, we appreciate your time,
Yeah.
and thanks for taking the time up today. We really appreciate it.
Pleasure.